There are some diseases that pass from generation to generation without getting any obstruction. If it is case of inheritance or a disease due to genetic disorder, it may be considered in that case because there is nothing to do with it. But if there is a case where a little bit of caution and care can prevent the disease from victimizing an innocent infant, the matter should be handled with care. Diabetes in pregnancy. Diabetes mellitus is an example of this kind of diseases. If a pregnant mother bears this disease, there is a huge chance for the infant to be contaminated by this disease. The type 2 of this disease can easily attack a patient with a coronary attack in the heart, and obesity is the main reason behind the attack of this disease. Complexity in conceiving and problems in menstrual can be the result of this disease. The thing may worsen if it is case of a pregnant woman. It may have fetal result for both the mother and the fetus if it becomes out of control. Women who have various diabetic problems can successfully give a birth to a child due to the close monitoring by some of the most technically advanced treatments. Diabetes in pregnancy. Diabetes mellitus can be categorized into two different sections depending upon the stage of the pregnancy: gestational diabetes and pre-gestational diabetes. The indications of this disease in the stage of a pregnancy can be traced out if it is examined with care. Sometimes the family history of both the parents can be helpful in finding out the root of the disease. Further, if the urine is tested in lab, the glucose level can be an important factor in tracing the disease. Obesity of the pregnant woman can lead to the cause of this disease. To restrict the spread of this disease, everyone should be educated, and awareness must be spread to restrict its heavy toll. There are some instructions which, if followed, can be proved immensely helpful to stay away from that disease. Leaving smoking or drinking during the time of pregnancy would certainly keep the disease away from that woman. Further, everyday checking the level of glucose level in one's home would be a good idea. Taking the help of an ultrasound scan to control fetal is another easy way to prevent that disease. Regular exercise is another good option that can naturally help one to get assaulted by the disease. Diabetes in pregnancy. If a woman with high diabetes problem wants to mother, it should be better for her to be pregnant after bring down the high glucose level. Preparation must be taken before 3 to 6 months from the time that has been affixed for getting pregnant. A rigorous maintenance of a strict lifestyle can do this miracle within a few days. After that, it is a pretty simple matter to give a birth to a child without scaring for the effects of the disease.